Hi everyone, in this video we are going to be discuss about prevention of STI. STI means it's a sexually transmitted infection that's passed from one person to the another person through sexual contact. It is also sometimes referred to as a sexually transmitted disease, but there is no real difference between what these two terms means. Um, there are different type of STI. There are chlamydia, gonorrhea, genital herpes, hepatitis B, HIV, HPV, syphilis, and trichomonias. These are the commonly having some STI problem in India. So next we'll see about the definitions of STI. So it is STD are series of transmissible diseases which infected through sexual activity or indirect contact transmissions. It may be a direct or indirect. Direct means sexual contact from one person to the another person. Indirect means through the towel or through that improper washing of that innerwear. So these and all it will be causing the infections. So now we are going to be list out what are the prevention of STI. So the first preventions will be avoiding sharing towels or underclothings. So some STDs, for example, the parasite Trichomonas vaginalis or rich can survive almost an hour outside the body. It causes vaginal infections in women and urethral infection in men, but is easily curable if you detected earlier. When you are having some discharge, when you are having redness, itchy, that time you have to be see the doctor very earlier time, and you have to go for the proper test what type of infection it is. So based on that you have to be consume antibiotic. If you are not treated properly, it will be a big trouble for the peoples. And this is a pubic lice, also known as a curbs, can also be a spread from infected bedding and the towel. So this is a examples of indirect transmissions through the bedding and the towel. The disease will transmit from one person to the another persons. So that the second prevention is wash before and after intercourse. So you have to be gently clean yourself after sex can protect men and women from infections like of the urinary tract infections. So they have to wash their private part before and after their intercourse. The next third prevention is get a vaccination for hepatitis B. This is a series of 3 shots. One important prevention tool against sexually transmitted disease and infection is vaccine. To protect against infection with HPV, hepatitis A, and hepatitis B. Who should get HPV vaccine means the young woman from the age 13 to 26 and the young men from age 13 to 21, and also the gay and the bisexual people and other men who have a sex with men up to age 26. The men with the compromised immune system up to age 26, so those people definitely they have to go for the HPV vaccines. So the next fourth prevention, you have to be get tested. So many STDs don't have symptoms, but they can still cause a health problems. The only way to know if you have a STD is to get tested. First, you have to talk with your healthcare provider about your symptoms, your signs, what are the problem you are facing. After that, you have to search for the CDC center nearby your locations, and you have to go and test it for the STI problems. The next fifth prevention is use of condoms. So using condom correctly every time to have a sex can help you avoid STD. It will be available for both for man and woman. There will be a different type of condoms. The next prevention is talk with your partner. So talk with your sex partner about STDs and staying safe before having sex. It might be uncomfortable to start the conversation, but protecting your health, it is your responsibility to talk and clear your doubt. And after getting the treatment, any one persons, after that only you have to go for the sexual intercourse. Next one is have fewer partner. Don't go for many partner. Always you have to be go with one person who agrees to only have a sex with you. If it is marriage, it will be a legal means you have to carry on with that one. So the next one is practice abstinence. That surest way to avoid STD is to not to have a sex. This means not having a vaginal, oral, or anal sex. Next is that educations we have to provide each and every college and schools about the informing students about the sexual transmitted disease is to include to our school the sex education program and their causes and effects, and have to avoid this case in every last day of class. We have to be regained about their hygienes, how to menstrual hygiene we have to follow everything. Thank you everyone.